Student involvement, like I said, IMAN was started by students. We still have medical student involvement on many different levels, and we're going to formalize relations with the different medical schools in the area. Again, what is your area and how can you use it? So we already have a relationship with the University of Chicago, so we have kind of a formalized arrangement with them already. We're already in discussions with Northwestern University, Loyola, Rush, and UIC, University of Illinois at Chicago. So these 5 schools, and eventually the goal is to each school take a night, and so medical students will do the evening hours of the clinic, and that'll provide the 12 hours. Mental health, it's a big deal these days, especially there's more focus on it. In fact, Friday morning there was a meeting between the American Muslim Health Professionals, and was IMAN part of that as well, with Department of Human, HHS, the Human Health Services. So there was a meeting around that. Imam Majid is well-known Imam, he was there, and so there's a lot of focus on mental health. Alhamdulillah, we have actually hired a social worker, and we will be starting them very soon, inshallah, to provide that much-needed healthcare system, much-needed mental health services. We also have a memorandum of understanding, an arrangement with a mental health hospital, so higher level of care. They would go there, and then once people leave the hospital, remember that continuum is very important, they'll be coming to us once they leave the hospital, inshallah. Dental health, I always put it, we need to do everything from mental to dental. So we actually were working with local dentists in order to provide that service, but also CMDS is the Chicago Muslim Dental Society. There's a lot of Muslim dentists in Chicago. I really didn't even know there was a Muslim Dental Society until I started investigating that. And so, alhamdulillah, through these, there is a lot of interested parties. We are in pretty much exploratory phase of how to do that and how to get that going, inshallah. Funding, that's the biggest question, isn't it? How do you do that? So private donors is really where IMAN started. IMAN started with, listen, we do a little fundraising here and there, and some very generous brothers and sisters and community members really stepped up and started doing that. And then Yasser mentioned about grant funding, saying, you really need a track record in order to be, considered a good candidate for a grant, but then if you don't have a track record, and, how do you get your grants for the track record, all that whole, that catch-22. Alhamdulillah, IMAN has been working for a long time, and so we were able to do that. So now we have not just private donors and private foundations, but institutions as well, and would be remiss not to mention our largest partner, Islamic Relief USA, stepped in a big way. They're a relief organization, and in Chicago, there's a lot of relief needed, so alhamdulillah, it was a natural partnership. And not to overlook the monetary versus in-kind type of donations, right? So we have an arrangement with a lab, and they don't give us everything for free yet, but give us everything for free, but a significantly discounted rate, right? So that's in-kind services as well. So strategy. Now this is really sort of where I'm trying to pull together themes and try to see what can be scaled to different or transplanted to other locations. Assess the resources available and leverage them. Volunteer-based, right? Like I said, there's a lot of students, not just the medical students and nursing students and philosophy students and all of that, but really undergrads provide a ton of energy. Muslim, non-Muslim, it doesn't matter. There's a lot of people that want to do a lot of good things. So volunteer-based is going to be an amazingly important, critical, and really indispensable resource. Funding sources, really, just find natural allies in your area. There are institutions in each area that will want healthcare in that area. Even if it was to just look at the local alderman's office. In Chicago, we have aldermen in the different areas of Chicago, but the local politicians will help direct you because they would love to have a free clinic in their area, if of course you need a free clinic in the area. Community service infrastructure, what I mean by that is we have, like I said, the Greater Southwest Development Corporation, we partnered with them. We have other organizations that we partner with on a regular basis for different things. Just see what organizations are there and what type of relationships you can build on that. And then healthcare infrastructures, hospitals, what kind of relationship can you have with hospitals? I haven't seen a free clinic yet that doesn't have a good relationship with their hospital close by. Educational institutions are natural allies. Ummah Clinic, when it was founded by students from UCLA, and that's really where they're located, and they have a very strong relationship with UCLA, and alhamdulillah, it's a great arrangement they have there. And then, of course, the local infrastructure, what I mean by that is what dentists do you have in the area, what other healthcare, like mental health resources are there in the area, what other type of healthcare are there in the area, just see what is there. And again, remember, everybody's situation is different. So once you've seen one health clinic free, or otherwise, you've really seen one. Any questions? This is my favorite slide right here. Any questions? Yes?
I do have easy access to the labs at a discounted rate.
Sure.
After going through the fascinating company, so I have some experience. So within my house, in the town hall, in the basement, for those Muslims who are struggling, they can go to the regular doctor, they can go to the free clinic. They have to free clinic, they're just overqualified. So for them, a few I do serve. So I mentioned the lab and they give discounted rate. But I have difficulty in getting discounted rate for radiology. How do you guys get discounted rates for radiology?
Sure.
It's just like a monster. So
it is. And we're really, that's what I said, for radiology in general, we're not getting a discounted rate. We're getting a discounted rate on the readings by the radiologists because there are a lot of Muslim radiologists in Chicago. And so we do have several social programs providing mammography for free for women. That's not our doing. These are existing programs that we tap into. And same thing for, I mean, this is a huge healthcare crisis if PPDs are positive, if there are TB skin tests that are positive. So for positive tests, there are interested people that want them to get testing and stuff like that. So that's what I mean about natural alliances and leveraging the resources in the area. So radiology by itself is a very difficult situation, but radiologists are very, very giving, and then you might be able to see who owns the different radiology centers, right? So either you have a hospital where you can get the radiology done, or there are freestanding radiology centers. You might be able to make arrangements with them.
So even the government has to do it, the community consider they have to do it, there's no way. So it can be done free. But if somebody is suffering with pneumonia or LAS or something, you want to do testing, it's just unreasonable.
It is. It is potentially out of reach, but again, making these types of formalized relationships is what has to be done. If you approach these, for example, there is a center very close by us that is, all they do is radiology. It's just a radiology center, and it's a private center. And so we've been in discussion with them, and they're saying, well, if you want free services, what can you do for us? I said, well, I do want to do something for you. I don't want to just leech off of you. And so we're in discussions on how to do that. And it's really something that you have to see what you can provide them and what they can provide you. So I approached one other organization about doing something for us for free. And I told them very straightforward. I said, look, in Islam, we're taught that the top hand is better than the bottom hand. Right? The hand that's giving is better than the hand that's receiving. So I don't want to put IMAN in a position of receiving only. So I want to actually give you more than you give me. Just because I'm not paying you doesn't mean I cannot benefit you. So let's see what type of arrangement we can come to. Let's see what you need and what we can provide, whether it's the training for your staff or whether it's something. We have a long track history of doing that type of thing. So what can we do for you?
A simple question. With this healthcare reform and should have healthcare, it's going to be mandatory to have insurance. Do you think what the outcome will be for these free clinics and
Great question.
Yeah. And the other part of it, that whichever Muslim community you walk into, mashallah, there are a lot of Muslim physicians, but they always want to help the community.
Sure.
More than 80% of the communities, they talk about somehow to start up these free clinics, but again, going back that we don't have the know-how, the rules of the states and the federals and where the funding, all that is coming. But with this, if it goes through the healthcare, what's the outcome? Should we put our efforts into this still, or should we just?
Mm-hmm. Yeah, we're undergoing that existential questioning ourselves. What is going to happen? And I guarantee you this: nobody has ever said throughout these entire discussions, debates, Democrat, Republican, whatever, that every single American is going to cover. Okay, they never said that. They said this many more people will be covered. okay, which leaves still. So I think the count, there's disputed counts of how many uninsured are there, 40 million, 50 million, but the count that said who's going to be covered is about 20 million, 30 million more. So there's still millions and millions of people who are not going to be covered, and they're going to be in the areas, large urban areas, and then the very, very distant rural areas. And then you notice the other thing that I said, Americans are going to be covered. So the people that are undocumented are still going to be a huge risk. Okay? So there's always going to be a need for free healthcare. Now, as far as the other part about what is the purpose of the free clinic, and then that's my baby, she just walked in. So the other part of that is just really, as I mentioned before, the top hand is better than the bottom hand. So do you really want to be a vehicle to perpetually put somebody at the bottom hand of your top hand? That's another philosophical question. Meaning that, do you want to be a source of consistent and constant sadaqah, that people consistently receive sadaqah? That's actually against the Islamic model. Well, I mean, Rasulullah taught us to give sadaqah in a way that it uplifts people. So how are we going to do that? It's a really difficult question, and we're really examining that and seeing what we want to do. And some of the patients come up with, do you take donations? Of course we take donations. Come on, we're just not charging you for the healthcare. One sister walked out, I call her sister, well, she's not Muslim, but she walked out, signed up at the desk to volunteer with us. In-kind service, in-kind donations. It doesn't have to be monetary. But there's many, many things, and the people have that natural dignity, the natural spirit inside of them. They don't want perpetual handout, right? And to do so to people diminishes the spirit. And so we don't want to do that, so we're coming up with creative ways not to do that. But there will always be a need for free healthcare, always.
So, is IMAN going to go towards FQHC or no?
So we are. So one of our board, full disclosure, one of our board members of the clinic advisory panel is a doctor who has, for the past, I'm going to undershoot it, I think it's more than 10 years, probably closer to 20, but she has actually been on the certifying end of it. She works on certifying clinics as FQHC. So she's put a tremendous amount of pressure for us to go towards FQHC, right? And I mean, I joke with her saying, look, a hammer always sees everything as a nail, right? So she always does this FQHC certification. She wants us to do that. So the 19 program requirements for FQHC, she gave it to me the first time she met me, and we're actually working on that for no other reason other than we want our clinic to be the highest level of care. Whether we pursue that or not is a different issue, but we always want to maintain the highest standards of care. And so this is one of those models, and so we want to, by any standard, we want to be among the best, inshallah. So I didn't answer your question on purpose.
Okay.
Yes.
Does your clinic provides, I mean, it's a good thing, that's what I'm saying. Credit for the volunteers who work. For example, a doctor puts in 100 hours during the year. So there is a credit that is issued to the doctor so that he can take it out from she can take it out from the taxes, from the bottom line of the taxes. The two clinics that that are there in our company, they do that. So your model, not the first one, but this way, do you get that, and do you provide to the doctors that, or to the nurses anybody who want to do this?
We don't. I'm not aware of that, so I'll look into it to see what that is, inshallah. And because we want to give advantage to the people that volunteer with us. One last thing I'll say, less than 30 seconds, inshallah, is a big thing for physicians, especially as malpractice. In Illinois, there is very, very strong Good Samaritan laws, and we've been assured over and over by lawyers that we do not need any further malpractice for our physicians. We still, again, want everything on the highest level, so we do contract with the largest malpractice insurance carrier in Illinois to provide insurance for our doctors at a very, very minimal cost. I mean, literally less than $100 a year. And so, but this is by the largest in the state, and just to make our doctors, like I said, we don't want anything to happen to them. Okay, thank you very much.
Thank you, Dr. Kaiseruddin, for covering that model, which is a free model where the patients are not expected to pay anything. Obviously, they can donate in kind or even cash, but they're not expected to pay. That is the free clinic model. Thank you, Dr. Kaiseruddin, for covering it.